Well, welcome everyone to the second quarterly educational webinar from NV Medical, and thank you so much for spending this hour with us. We had a great call this morning and hope to duplicate it again this afternoon with a new group of people. I wanted to introduce and thank Dr. Felipe Jimenez for joining me again on this call. It has been such a pleasure. He is the Chief Scientific Officer here at NV Medical. He also has a PhD in biochemistry, and he was previously the Director of Scientific Affairs at Obagi Medical Products. So as we are talking about lightning protocols, he is definitely the expert. So thank you, Dr. Jimenez. I really appreciate you being on the call with me today.
Well, thank you, Cindy, for the introduction. I truly appreciate it. And thank you for doing such a fantastic job of hosting our webinar series. You did such a fantastic job this morning. And I just also wanted to thank our audience for taking the time this afternoon out of their busy schedule to really attend our first webinar of the year 2014.
Yeah, thank you so much. So we obviously are talking about new beginnings, which everyone seems to look at the beginning of every new year. We are going to help your patients restore and give them bright, new, healthy skin for 2014. I want to talk a little bit about it is the new year. Everyone is reviewing what they can do better this year than they did last year. We all have our New Year's resolutions, and at the top of those lists is probably for most people is exercise more, eat healthier, get more rest, with the goal of feeling healthier and looking younger. So that is a great segue and a great time to promote our brightening home care products as well as the fabulous SilkPeel with our brightening protocol as well as our patented peptide that is in those solutions. So you'll be seeing a lot more patients coming in with lackluster, dry, and discolored complexions due to the damage that has been caused by all the late night partying for Christmas, Thanksgiving, and New Year's. So now you can help everybody repair and get back on track for 2014. Hyperpigmentation is the second most common skin concern right after acne. And I'm sure you have noticed it mentioned on almost every skincare commercial in the last couple years. It's become a very hot topic. And everyone is really looking to get back that newborn skin before we've done all of the environmental and aging damage to it. So we know that clear, bright skin is a sign of a youthful and healthy person, and it is amazing how many physicians just focus so much on Botox and fillers, and then they sort of neglect that most important piece of the skincare pie, which is your overall complexion. So this is a great way for you to easily incorporate that into even more events, as in Botox parties, and put that SilkPeel as another promotion to go along with that. We have a very effective and gentle solution for all of your clients that are looking to get younger looking skin. When you stack procedures and combine them with effective skincare, your patients can really achieve amazing results with much less expense and pain and downtime of other more expensive sort of one-shot treatments. So it's all about cumulative results, and that means that you can customize a protocol that can really fit anyone's pocketbook and fit nicely into anyone's lifestyle. Oops, I went too far. So Felipe, tell us a little bit about the Lumixyl topical system as in the home care. I know that this is a real breakthrough in lightning technology and that it offers a solution for people with not only sensitive skin, but people that just don't want to have so much impact on their skin because they need to go out into the daily public and feel good about themselves as they're repairing their skin.
Yeah, absolutely. Definitely, as Cindy mentioned, we definitely offer two treatment modalities really to treat hyperpigmentation. The first, obviously, is our in-clinic procedure with our SilkPeel dermal infusion device, and the second really it has to do with using our Lumixyl Topical Brightening System, which is our take-home product or our take-home system. So the Lumixyl Topical Brightening System is really composed of 4 different products. Step number 1 involves the use of our Active Prep Cleanser. This is a very cool cleanser because it is an acidic non-soap cleanser, so it definitely helps to get rid of the excess dirt and oils on the surface of your skin. But at the same time, because it is acidic, it also helps to improve or drive better transdermal penetration of our key ingredients that can be found in our brightening cream and some of the other products that we do have in this particular system. At the same time, the Active Prep Cleanser also makes use of botanical antioxidants that definitely help to begin to slow the overproduction of melanin in skin as well. Now, the second step within the Lumixyl Topical Brightening System is step number 2, which is the brightening cream that does contain 0.01% of our decapeptide 12 technology, which is proprietary to NV Medical. We definitely in-licensed decapeptide 12 on a worldwide exclusive basis from NV Medical. I'm sorry, from Stanford University. And this is really the workhorse of our system because this is the ingredient that definitely can go into the skin and really inhibit the tyrosinase enzyme that can overproduce melanin in skin. The step number 3 within the system involves the use of our GlycoPeel 10 product. This is the product that contains 10% buffered glycolic acid. It's buffered up to pH of about 3.5, and this particular product is meant to exfoliate away all of those hyperpigmented layers of skin. So basically, if you look at the first 3 steps within the system, steps 1 and 2, the Active Prep Cleanser and the brightening cream really act to regulate the overproduction of melanin in skin at the cellular level, whereas step number 3, which is the GlycoPeel 10, really helps to exfoliate away those hyperpigmented layers of skin. Now, step number 4, which is our last step within our Lumixyl Topical Brightening System, involves the use of the Moisture Lock Sunscreen SPF 30. Now, this particular product is a 100% physical sunscreen, which means that it makes use of 8.4% titanium dioxide, and in doing so, it basically acts like a physical barrier or a mirror of sorts that helps to reflect away both UVA and UVB rays away from skin so that the energy of these rays never penetrate into the viable layers of the epidermis. The other very cool thing about step number 4, our sunscreen, is that it does contain Simhelios 1031. And Simhelios 1031 is an ingredient that acts as a second layer of sun protection to the skin. And the way that it works is that it helps to inhibit the penetration of toxins that are actually born out of the interaction of UVA, UVB rays with certain free amino acids within our skin. And so basically, I'll give you an example. There's one particular amino acid in skin. It's a naturally occurring, so it doesn't just occur in skin, but it occurs in all of the tissues of the body. It's called tryptophan. And when tryptophan comes in contact with these UV and UVB rays in skin, basically it becomes toxic, but it only becomes toxic to the skin if it's able to penetrate into the skin cells themselves. And so what Simhelios 1031 does is that it helps to inhibit this penetration of that toxic form of tryptophan into the cell so that it doesn't cause any damage to these skin cells. And obviously in doing so, we can definitely prevent things like hyperpigmentation and certainly the occurrence of photo damage as well.
So even that sunscreen, just as a standalone, is a great anti-aging tool.
It's a wonderful anti-aging tool for sure.
So let's talk a little bit about the type of skin conditions that this system and this technology is best used for.
Yeah, absolutely. The main indication for the Lumixyl topical brightening system is the treatment of hyperpigmentation, whether it's in the form of melasma, and some people know it as cloasma or pregnancy mask. You can also use it to treat post-inflammatory hyperpigmentation, which is the dark spots that we could typically get from having inflammatory acne, or it can be used also to treat sunspots or solar lentigos as well.
And Felipe, tell me a little bit about the product highlights. I know that it is definitely safe for all skin types because we've had so many clients come in that couldn't do other systems and really were able to tolerate this system quite easily.
Yeah, absolutely. The Lumixyl topical brightening system is definitely safe for all skin types. And we know that it's safe for all skin types because we have tested it under repeated insult patch testing in about 150 patients now. And, definitely we've never seen any sign of allergic reaction, nor any sign of a major irritation on the skin as well. The products have been dermatologist tested, as I just mentioned. They've been allergy tested as well. We have very modern formulas as well, in that they are paraben free. They also don't use artificial colors at all. And best of all, you definitely do not need a prescription to get and use Lumixyl products. Steps 1, 2, and 3 are definitely considered cosmetics, whereas step number 4 is an OTC product. That would be our sunscreen, and you definitely don't need to get any kind of prescription to use these products.
And then, in your recommendation, what is the best way to use the Lumixyl system? When you're using it for home care.
Yeah, it's very, very simple to use our Lumixyl system. In this case, the slide that you're looking at here has recommended instructions for use of our Lumixyl system that does contain our Glycopil 10 product here. So I'd like to point out, first of all, that there's only 4 core products that you would need to use in the Lumixyl system, whereas if you look at other products out there on the market, like the Obagi Nuderm system or some of the others out there, sometimes you have to use up to 5, 6, or even more products throughout the day to be able to get the results that you are wanting to get out of those systems. In this case, the Lumixyl system is only composed of 4 different products. So let's go through it. Step number 1 would be to cleanse the skin. You definitely want to do that twice a day, every day, preferably in the morning and at night. You definitely want to apply the cleanser liberally on the skin. Best thing to do with this particular cleanser is to go ahead and lather it on your face for just about a minute, and then just go ahead and wash it off thereafter. Go ahead and towel dry, then go ahead and apply 2 pumps of the step number 2, which is our brightening cream. And again, this product should be used twice a day, every day, preferably in the morning and at night. You want to go ahead and massage that into the skin. Make sure that the skin is fully dry. Then go ahead and apply step number 3, which is our Glycopil 10 product. With this particular product, you want to use just enough to cover the entire face. So that's why we say here that you want to go ahead and just apply a thin layer of Glycopil 10 just to cover the entire face. With this particular product, I actually put AM here, but it actually should say AM and PM, because you definitely want to use the Glycopil 10 twice a day, every day, not just once a day. For step number 4, this again is our Moisture Lock sunscreen. You definitely want to apply liberally in the morning. Preferably, we would want you to apply this just before going out into the sun throughout the day. So that could involve, possibly applying it 2 to 3 times per day.
And then, why don't you review some of these great before and afters that you've gotten sent in from physicians all around the world? And I wanted to just make sure everyone knows that these are before and after pictures that have been submitted to the company that are in clinical studies that are using just the home care only, no silk peel or other type of devices to increase the results.
Absolutely. In this case here, this before and after photo set was actually sent in to us by Dr. Huang out in mainland China. As you can see here, this particular patient here has actually two different types of hyperpigmentation. It looks like she's got a pretty big solar lentigo there right on the side of her nose. And then she's got a very mild patch of melasma. It looks like it may be, a melasma or possibly even some solar lentigos there. But anyway, after 12 weeks of using our Lumixyl topical brightening system, definitely you can see a nice improvement there in both that very large lentigo there as well as the mild melasma patch there on the side of her face. And again, she didn't use any lasers, she didn't use chemical peels or microdermabrasion or anything else. She simply used the Lumixyl topical brightening system as prescribed for 12 weeks, and she's able to get some fantastic results. I think the
And
other thing to really point out as well is her skin does not appear to be overly dry, overly irritated. There's no redness, there's no erythema there either. So that just kind of speaks to, also the tolerability of the Lumixyl topical brightening system. Not only are you going to get excellent results, but you're going to get very, very good tolerability out of this system as well.
it looks to me too like her texture's better.
Her texture definitely is going to be better. One of the things that you'll notice probably after the first 5 or 7 days of using the Lumixyl topical brightening system is that your skin texture is going to be vastly improved as well. And I think that's really what you notice there in that first photo set. Now, this second photo set here comes to us courtesy of Dr. Sandra Ramirez. She is located out in Colombia and South America. Her group did a clinical study for us about a year ago. This particular study was just recently published last year in the Journal of Drugs and Dermatology. And as you can see here, this woman here definitely has a nice melasma patch there on her cheek. And after 16 weeks, you can see that a lot of that has blended in nicely or is starting to blend in nicely with the surrounding skin tone as well. I'll point out one other thing. This particular patient does have mixed epidermal and dermal hyperpigmentation, so it's going to be a little more difficult to get rid of just because it's deeper down into the dermis as well. So it's going to be a little bit more difficult to get rid of. The other thing that you have to keep in mind as well when you're treating patients with darker skin types, obviously their skin is going to naturally want to produce more melanin, and in doing so, obviously, it's kind of an uphill battle that you're fighting, against the skin's normal tendency to produce more melanin. But even then, you can see here that there's a nice improvement there after 16 weeks.
Well, and there's also an evenness to her skin where it's not like she's so much lighter that even though
Right.
the melasma has gotten lighter, it looks darker. Like there's more of a blending there that
Well,
looks
I
more
think
natural
that
than you've seen in a lot of other topicals.
that's the real goal of the Lumixyl topical brightening system. Is not just to get rid of the hyperpigmented spots, but to really even out the overall skin tone in the skin as well. I think that's what you're seeing in some of these pictures as well. So moving on to the next before and after photo, this comes to us courtesy of Dr. David Goldberg out in New York. And he also did a study for us as well that was published probably about 2 or 2.5 years ago as well. In this particular case, this patient, female patient, definitely came in and had what appeared to be a mild melasma patch on the side of her face, but upon Wood's lamp examination, definitely it appeared that she had a mixed type of hyperpigmentation where she had not only superficial epidermal hyperpigmentation, but it was also down in the dermis as well. So that's why it took just about 24 weeks to get rid of it. Again, this holds true for pretty much any system out there in the world, including the Aubergine system, the deeper the hyperpigmentation, the longer it's going to take, to really resolve that hyperpigmentation, really smooth out the texture and the tone of the skin. In this case, this before and after set comes to us again from South America from Dr. Luque. Again, this was part of another study that we did in South America. This young man definitely has a melasma patch there on the side of his face. Now, this is unusual because only 5% of all men around the world actually get hyperpigmentation, and he happens to be one of those few. And so here you can definitely see that after 8 weeks of using our Lumixyl topical brightening system, that we were able to, or the system was able to resolve that hyperpigmentation on the side of his face. Again, he didn't use any lasers or microdermabrasion or anything else. This is just simply using the Lumixyl topical brightening system, nothing more. This last photo set here also comes to us from Dr. Huang from mainland China. This is your typical severe melasma patient here. As you can see, the melasma pretty much is covering the entire side of her face and around her nose area as well. As you can see, after 12 weeks of using our Lumixyl topical brightening system, you can see a huge difference there in the melasma. It's resolved. I'd say you've probably got about a 70 or 75% resolution there in her severe melasma there. And again, I'll point out the fact that, even before starting the use of our Lumixyl system, she appears to have a little bit of erythema there, especially around the eye area as well. After 12 weeks of using our Lumixyl system, a lot of that has gone away. She may have a little tiny bit of redness, a little bit of a pink hue there around her nose and on her cheek there after 12 weeks. But as you can see, the melasma has definitely resolved vastly from when she started back at baseline. And again, there's no real peeling here. There's no sign of any kind of really bad irritation or inflammation there as well.
I mean, she looks less inflamed 12 weeks later than she does baseline.
You're absolutely right.
And then let's talk a little bit about, there are a lot of systems out there in the marketplace that claim a lot of things. I mean, we all know that Obagi New Derm system has been selling quite well for, I think, maybe 20 plus years. So how does this system stack up against other systems or just individual lightening products, especially when we're talking about speed of lightening and then also the depth of the melasma that it can attack, so to speak?
Yeah, absolutely. So basically, running just through the competitive advantages of Lumixyl, you see that definitely Lumixyl is hydroquinone free. The reason that that's an advantage, obviously, is because of some of the tolerability issues that we all know about with the use of hydroquinone, whether it be the irritation that it can cause. And some people, and again, this is a vast minority of the population, that there is also the risk of exogenous ochronosis. Exogenous ochronosis, for those of you that are new to the term, is simply the accumulation of homogentic acid underneath the skin, which really causes kind of a grayish hue to the skin. So it causes a type of hyperpigmentation that you really can't get rid of easily. And then obviously, as I mentioned before, the use of hydroquinone in some people can definitely cause allergic contact dermatitis as well. So definitely Lumixyl does not make use of hydroquinone. It definitely makes use of our proprietary decapeptide 12 technology, again, that we license from Stanford University. The other advantage, again, is that there's no downtime to the patient. With the Aubergine system, you definitely see that not all patients, but definitely a majority of patients can definitely go through what we used to affectionately call an ugly phase, in which the patient, once they started using the Aubergine system, they would get very red, very irritated. There could be also some edema there, and after some time, they would be peeling more like a snake. So definitely, those patients didn't like being seen in public that way. So a lot of times, they would definitely go ahead and plan their Aubergine system treatments around their vacation time so that they wouldn't have to be seen in public. I think the other very cool thing about using the Lumixyl system is that it does minimize pores and it does help to smooth and rough skin. And these are more of anti-aging type of effects of using our Lumixyl system. So, in reality, the Lumixyl system is not just an anti-hyperpigmentation system, but it's more of an overall skin health system, more of an anti-aging system as well, that can definitely help with the hyperpigmentation, but also helps to minimize pores and helps to smooth and rough skin. Now, as far as comparing the efficacy of the Lumixyl system with other systems like the Aubergine system, I think that the efficacy of the Lumixyl system is probably more closely related to or more closely comparable to that of the Aubergine system in that they work at fairly similar rates. But again, the biggest difference is that the Lumixyl system definitely does not cause any downtime to the patient, whereas whereas the Aubergine system can definitely cause patients to undergo that ugly phase that we just talked about before. So that would be the biggest difference. I just wanted to point out one other thing. In the last webinar, there was another question about how our system relates to the Allure product that's out there on the market today. Just very quickly, the Allure product basically makes use of a technology. It's actually an enzyme that they use. It's called lignin peroxidase, and basically what it does is it helps to break down melanin in the superficial layers of the epidermis, mainly the stratum corneum. So basically what that product does is it gives the skin an overall lightening effect, but it really doesn't do anything for hyperpigmentation spots, whether it's melasma, PIH, or sunspots. So that's really the biggest difference between Lumixyl and Allure in that, again, Allure just works on the superficial layers of skin, whereas the Lumixyl system can definitely be used to treat more traditional types of hyperpigmentation, again, like melasma, like PIH, and like sunspots.
And I don't think many people know the reach that Lumixyl has obtained around the world, and really just kind of, how much distribution we have. And I thought that was a kind of unique thing to share with everyone that's on the call.
Yeah, absolutely. Lumixyl is definitely sold in about 30 countries around the world, including the US and Japan. Now, these are two of the top four global skincare markets around the world. We definitely expect to launch Lumixyl in Brazil and China as well by the end of this year. And that will definitely complete the commercialization of Lumixyl in all four of the top global skincare markets, hopefully again by the end of this year.
Right. And let's talk a little bit now. I think everybody really gets a better sense, if they didn't have it already, of the Lumixyl, technology and the patented decapeptide 12. But the other, piece of this, two-pronged solution is the SilkPeel. And I think we all know that it works, but I don't know if everyone really understands exactly how it works.
Yeah, absolutely. So very briefly, the SilkPeel procedure makes use of three different components, really. We make use of vacuum, and in vacuum, essentially what helps to bring the skin in contact with the recessed diamond tip within the handpiece. And obviously the diamond tip is there to really cause the exfoliation of that stratum corneum as you glide that handpiece over skin. Now, the third component of the SilkPeel procedure is what we call dermal infusion. Okay, this is the process by which we deliver solutions deep into skin, and when I say deep, we are able to deliver these solutions as far down as the dermal epidermal junction using pneumatic pressure. Now, dermal infusion is different than what you would find with other devices out there that claim to be wet microdermabrasion devices. So the difference between a wet microdermabrasion and dermal infusion is very simple. Okay, with dermal infusion, what you're doing is you're delivering solutions into skin, okay, under positive pneumatic pressure. So what that means is that when you bring the solution into the handpiece under pneumatic pressure, what it does is it strikes the skin with positive force such that you're actually forcing that solution down past the stratum corneum and down as far as the dermal epidermal junction. Now, for wet microdermabrasion, basically what you're doing is you're dripping solutions down on the skin, okay, and basically what these solutions do is that they're able to wet the skin or lubricate the skin so that the microdermabrasion is actually more pleasant to the patient. But as far as penetration goes, it doesn't penetrate very far down into the skin because again, you're simply topically applying the solution onto the skin. You're not really forcing it into the skin through pneumatic pressure, the use of pneumatic pressure, as we do with dermal infusion with the SilkPeel device.
You know, and the other thing that I love is that you're infusing 4 ounces of solution into the skin in 20 minutes, and the result is skin instant gratification. You're going to have skin that has more volume, it's tighter, it feels younger, it has a fantastic glow. You're literally going to have 70% more volume in the skin, after just one single treatment. And the solution, it's saturating the entire epidermis, which no other machine can do, and then it stays in the skin for up to 72 hours. So it's instantaneously fantastic, but then it also is wonderful when you continue to do the treatments in a consecutive basis. So let's,
Yeah,
yeah, go ahead.
yeah, absolutely. And I think the other thing to point out, another big difference between SilkPeel and some of the other devices out there on the market, and I'll just point one out, the hydrofacial device out on the market. The biggest difference between these two machines really is the fact that with SilkPeel, you're able to tailor the procedure to treat various different types of skin concerns by simply using one of our four different pro-infusion solutions to treat either dry skin, anti-aging concerns, acne, or hyperpigmentation. If you look at the hydrofacial machine, they claim that it's the same thing as SilkPeel, but it really isn't. I would liken it more to a traditional microdermabrasion device in that it's kind of a one-trick pony. So that if you look at the procedure that is prescribed for the hydrofacial device, basically you'll see that it's kind of a one-size-fits-all in that everybody, all patients get the exact same procedure. They use the exact same solutions, whether it's their glycolic solution or anything else that they're running through the machine, but it's always the same. So you can't really tailor that particular device to be able to treat skin-specific conditions. Again, with SilkPeel, we can definitely do this very easily by simply switching out the type of solution that we're using. Again, here I've listed dry skin, anti-aging concerns, acne, and hyperpigmentation, but we definitely have doctors out there that are using these solutions and certainly the SilkPeel for other off-label indications as well, whether it's to treat keratosis pilaris or some of the other off-label indications that they're treating for with our SilkPeel device. So that's really another huge difference between SilkPeel and other devices on the market today.
Well, and then also I like it that you can still combine solutions. You can use a pass of the Clarity MD, which is the acne solution, and then follow it up with a pass of the vitamin C solution if you've got somebody that has, for example, adult acne. So you're going to hit the acne, but then the skin's going to feel really rejuvenated and refreshed with the vitamin C solution right after that. If you have people that you're treating that are acneic but have sensitive skin, you can also do the hydrating solution and then follow it with the acne solution, or even vice versa, whatever you think would work best for your particular client. and that's great for teenagers. So it's nice to know that when you open up a bottle, you have 2 weeks that are still, it's still a viable and stable solution, and you can sort of even do spot treating on people that are mostly dehydrated but then have a few little acne spots here and then, or save some hydrating solution to do the eyes if you're doing an acne protocol. So there's lots of flexibility and lots of customization, which I think patients really do appreciate. So again, with the SilkPeel, it's 20 minutes, so it's a half an hour. It's absolutely a lunchtime procedure. I like to combine the SilkPeel with many other things that are happening in the office. It's a great treatment for after a chemical peel, 7 to 10 days post or after a photofacial, because it really hydrates and polishes the skin. It's fantastic for pre-IPL or laser. It will reduce pain for the patient as well as help the laser target more effectively and save jewel life on the laser. So that's definitely a win-win. And it's just great if you start to use a silk peel before you apply anesthetic before a more laser or more aggressive procedure. The patient is then introduced to the silk peel. They really like it and they know it's available for maintenance. And I don't think enough practices really think about having an insurance protocol for the amount of money that their clients are coming in and spending on these more expensive treatments. If you're going to, put down several $1,000s for a series of photofacials or IPLs, you want someone to tell you, how do I maintain my results so I can keep the great results that I have just invested so much money in. So a lot of ways that Silk Peel can continue your practice, and it's also, we sort of call it the Botox for fillers. You know how Botox is like a gateway drug for a lot of fillers and other injectables. Silk Peel is a great gateway drug for more more serious, more expensive procedures that someone may not really be ready for a photofacial, right out of the gate. But a few silk peels, they really love that, and they're more open to experiencing some other technologies that you may have in the practice for them. So Felipe, here are some before and afters that I'd like for you to speak on. And I want to reiterate that these, again, are solo clinical trials, that these are now just silk peels and there is no home care that is being used to quicken the results.
Yeah, absolutely. As you can see here, SilkPeel is definitely perfect for treating melasma on the face. This particular before and after photo was sent to us by Elaine Cook, Dr. Elaine Cook from Amarillo, Texas. As you can see here, with a total of 5 SilkPeel treatments done once every 2 weeks, the SilkPeel was able to resolve the melasma patch there on the side of the face of this particular patient. And again, this is just over 8 weeks, so that's pretty amazing that she was able to get such quick results in such little time. And again, with just 5 SilkPeel treatments done once every 2 weeks. The next slide over. This before and after photo was sent to us courtesy of our distributor out in Thailand, Mr. David Tay. Basically, you can see here that SilkPeel can also treat solar lentigos very effectively. Again, in this case, we were able to get very, very good results in 10 weeks, basically using a total of 6 SilkPeel treatments done once every 2 weeks. And again, you can see that the solar lentigos there have definitely resolved, on the side of her face and even up around the eye area as well. Moving on to the next slide here, we can definitely treat post-inflammatory hyperpigmentation effectively as well with SilkPeel. In this case, this before and after photo set was sent to us by our good friend Dr. Ashish Bhatia over in Naperville, Illinois. He basically employed a total of 5 SilkPeel treatments done once every 2 weeks. And after 8 weeks, you can see that a lot of that PIH has definitely been resolved. And even the acne, the active acne that she was having there has been resolved as well. So, very, very good results in just 8 weeks. Our last before and after photo set is just a great testament to how well the SilkPeel treatments can work for photo damage. Again, this particular patient had a total of 4 SilkPeel treatments done once every 2 weeks. And after 6 weeks, you can see that all of the hallmarks of photo damage on her skin have definitely been resolved, so that a lot of the leathery appearance, the mottled hyperpigmentation, some of the solar lentigos that she's got there, and even some of the finer lines, the dry lines around her eyes, the perioral area have definitely been resolved as well. So definitely, SilkPeel can definitely have a great impact on photo damage patients as well.
And she looks like she has just more elasticity, like her skin is healthier. It's not
Right,
just the
it's
lightening. Yeah.
it's completely rejuvenated for sure.
So I know we talked a little bit about this, but are there any things on this slide that you wanted to point out to everyone on the call today?
Yeah, there's two things, actually three things to reiterate here. And point number two there, the fact that it's not operator dependent. This is another really big difference between SilkPeel and other devices on the market today. With SilkPeel, basically the machine does most of the work. Okay, so all the operator really needs to do is to simply glide the handpiece over the patient's skin. The operator definitely does not need to apply any kind of downward pressure to achieve the exfoliation. The vacuum within the handpiece will definitely help to pull up the skin up into the handpiece and in contact with the recessed diamond tip. And basically, with the operator just simply gliding that handpiece on the skin, you can definitely achieve even you can achieve even exfoliation every time. If you look at just reproducibility even of one SilkPeel procedure to another, it's just astounding. How you're able to reproduce results in the same patient every single time. The other thing to point out here, and I think we talked a little bit about this as well, is that the SilkPeel procedures themselves can definitely be customized to treat various skin conditions. And again, you do this by simply using one of 4 different solutions, skin-specific solutions that we have developed to treat dry skin, acne, hyperpigmentation, and other anti-aging concerns as well. The third thing to point out as well is that SilkPeel is really the only dermal infusion device on the market today. All of the other devices that claim to be similar to the SilkPeel are what we call wet microdermabrasion devices. And again, the difference between wet microdermabrasion and dermal infusion is the fact that dermal infusion uses pneumatic pressure to force solution into the skin down as far as the dermal epidermal junction using positive pneumatic force. Whereas with wet microdermabrasion, you're simply dripping solutions onto the skin. So you're really applying these solutions onto the skin topically, and so they're not able to really penetrate into the skin as effectively.
And I always like to use the terminology that Curtis does. It's like a prisoner exchange. So, it's like a wet, dry vac. So, what you're doing is we are sucking out all, the congestion, the comedones, the whiteheads, the blackheads, and then in its place, we're putting a good prisoner. And that's going to be either the hyperpigmentation or the hydrating or the vitamin C or acne solution. So I think that,
Absolutely.
really helps the end user or your patients when you're trying to talk about what you're doing to their skin. They really can understand exactly how therapeutic this process can be in only 20 minutes.
Absolutely.
So I know that we have come up with an awesome brightening facial protocol. So Felipe, I am going to let you just sort of explain to people how the esthetician should be performing this protocol in the back bar, and then we'll talk about the promotions.
Absolutely. So, with the Lumixyl Brightening Facial Protocol, this is a facial that basically makes use of not only the SilkPeel procedure itself, but also the take-home products that you would send the patient home with thereafter. So, basically, step number one is to go ahead and cleanse the face. So, you definitely want to moisten the skin, the facial skin. You want to go ahead and then lather the active prep cleanser onto their skin for about a minute. Then you want to go ahead and rinse it off. Go ahead and towel dry the skin. Once it's fully dry, you want to move on to step number two, which is essentially performing the SilkPeel procedure on the patient you definitely want to use the Lumixyl Pro Infusion so that they do get a dose of the decapeptide 12 technology that we do have in this Pro Infusion. And again, the decapeptide 12 technology will definitely help to regulate that overproduction of melanin in skin at the cellular level. After doing the SilkPeel procedure, you want to move on to step number 3, which is our post-treatment. What you want to do is you want to take several Lumixyl brightening pads. You want to go ahead and apply the Glycopil 10 gel onto these pads. You want to go ahead and spread it all over the pad. Then you want to go ahead and apply this pad that's been infused with the gel onto the trouble spots on the patient's face. You want to go ahead and allow these pads to sit on the face for about 5 minutes. After 5 minutes, you want to go ahead and remove the pads. Any excess gel should be definitely put on the skin, massaged into the skin around those trouble spots. And then you want to go ahead and let this Glycopil 10 gel dry. Once it's dry, then you want to go ahead and apply the Moisture Lock sunscreen thereafter. And that pretty much rounds out the Lumixyl Brightening Facial.
Great. It's really an effective treatment, and it's still you're only using the room for a half an hour max.
Right.
When we are doing the brightening facial, is there anything that we need to be aware of, as in what we can or can't do pre and post of this brightening facial?
Yeah, absolutely. I think that one of the best things that you can do to really enhance or improve the outcome of the SilkPeel in-clinic procedure is to use the Lumixyl brightening system as prescribed pre and post SilkPeel facials, okay? The one thing that you really need to be cognizant of, you need to be careful of, is that you really want to stop using the Glycopil 10 at least 48 hours before your SilkPeel Lumixyl facial. The reason why you want to do this is because the Glycopil 10 on its own, you know this better than I do, helps to exfoliate that stratum corneum, so it thins it out. Okay, so what happens if you continue to use the Glycopil 10 right up until the time that you have your SilkPeel facial? Well, what's going to happen is that the stratum corneum is going to be so thin that there's a good chance that the SilkPeel procedure may actually lead to scratching of the skin, because now basically the SilkPeel is not only removing that very thin stratum corneum, but it's also starting to scratch the viable layers of the epidermis underneath. Now, the other thing to be aware of is that you want to stop using also the Glycopil 10 for at least 24 hours after your Lumixyl SilkPeel facial. Now, this seems counterintuitive, right? We just told you that you want to do the SilkPeel treatment, and then you want to go ahead and apply the Glycopil 10 thereafter on the pads. And basically, and I forgot one other thing. When you apply the pads that have been infused with the Glycopil 10 onto the patient's skin, it's probably best to do that cold. So you definitely want to refrigerate both the brightening pads as well as the Glycopil 10 prior to applying it onto the skin. That gives it's going to give the patient just a better feel, more pleasant feel on their skin, a more soothing feel on the skin when you apply both the Glycopil 10 and certainly the brightening pad onto the skin cold. Now, the reason why you want to stop using the Glycopil 10 after the facial is because you want to let the skin rest, okay? After doing the SilkPeel facial, your skin is going to be a little bit raw because we just removed the stratum corneum and we put another dose of Glycopil 10 on the skin, so that if you went home immediately after your SilkPeel facial and you apply the Glycopil 10, there's a good chance that you're going to get more irritation, and as a matter of fact, you may actually develop a dermatitis rash thereafter, just because the skin is so raw and you're overloading it with acid after having removed its stratum corneum. So you definitely want to be careful with that. You definitely don't want to irritate the skin, so it's best to just let it heal for about 24 hours. let it build up its stratum corneum again before continuing the use of the Glycopil 10 thereafter.
And then, and obviously, this slide isn't a perfect world because not everyone has a pocketbook that's big enough to be able to do a silk peel every week. But I really do want us to know kind of what is our target. Like what are we trying to do in terms of frequency to get the best, bang for our buck for our patients that are coming in.
Absolutely. So in a perfect world, if you've got mild hyperpigmentation, you definitely want to come in for a SilkPeel every 2 weeks for a total number of 4 to 6 SilkPeels total, and that should be enough to really resolve your mild hyperpigmentation, especially if you're also using the Lumixyl Topical Brightening System take-home products as well. That should help to really improve the outcome of the SilkPeel procedure as well. Now, if you do have more moderate to severe hyperpigmentation, it's probably better to come in, again, in a perfect world, early on just once every week until you're able to gain control of that hyperpigmentation, and then you can go ahead and start coming in for SilkPeel treatments at least once every 2 weeks thereafter. We feel that a total number of 6 to 8 silk peels should be enough to really help with that moderate to severe hyperpigmentation, especially if you're using the Lumixyl Topical Brightening System, the take-home products, along with these silk peel procedures as well.
So let's say we're done with our silk peels and we did the great frequency and our skin is looking absolutely amazing and we have made an investment in our skin. Now, how do I keep it that way?
Yeah, absolutely. You definitely want to go on a maintenance regimen. And basically, once you're happy with the results, you definitely want to do at least a Lumixyl brightening, a single Lumixyl brightening facial at least once a month. And definitely you want to continue to use the Glycopil 10 at least once per month. Now, why do you want to do that?
Or once per day?
Well, or one, I'm
Once per
sorry,
day.
once per day. Yeah, you
Yeah.
definitely want to use the Glycopil 10 at least once per day. So why do you want to do that? The reason that you want to do that is because, as I may have mentioned before, there is no cure for hyperpigmentation. So that if you completely stop using something that inhibits the tyrosinase enzyme in skin, basically that tyrosinase enzyme is going to be free to overproduce melanin again, and so that you'll get that hyperpigmentation coming back. So you definitely want to continue to use a tyrosinase inhibitor. Now, one of the things that a lot of people overlook is the fact that Glycopil 10, aside from having 10% glycolic acid, also contains 0.01 decapeptide 12. This is the same strength as you would find in our Lumixyl cream. So if there's one product that I would recommend using as a maintenance regimen, I would recommend using the Glycopil 10, only because you do get the exfoliation from the 10% glycolic acid, but you also get the single dose of decapeptide 12 from this particular product as well.
Right, and I feel like there's a lot of physicians out there that really ignore a maintenance prescription. There will be a patient that comes in and they have a skin condition that they want to get remedied, and a lot of times we will help them fix that, but then we don't give them any information or insurance, so to speak, to say, so now that this is where you're at, this is your prescription for keeping your skin at the level that we've just maintained it, or gotten it to. So I think it's important for us to sort of make sure that our physicians and our staff have great verbiage on how to literally prescribe a maintenance protocol.
Absolutely.
Now, this is questions that I have been receiving at my med spa since we started with the Lumixyl and the Silk Peel. A lot of people have their favorite products and they want to incorporate the Lumixyl system, but they don't really know how to do so in terms of order of, when can I use a retinol or a vitamin C or retin A. And so I'm sure at the end of this conference, people will be printing out this slide and keeping it for reference. So it's fantastic. So help us understand this slide if you wouldn't mind.
Yeah, so very briefly, for those people that like to use retinoids, with the Lumixyl system, it's very, very simple. So if you're using tretinoin, you definitely want to apply that at night, okay? But you don't want to apply it before or after the Glycopil 10, so that you would use the tretinoin at night and then you would only use the Glycopil 10 in the morning, okay? So basically the way to use the tretinoin is to go ahead and cleanse the skin with step number 1. You want to then go ahead and mix step number 2, which is our Lumixyl cream, with the tretinoin at a 50-50 ratio. You want to do that on the back of your hand, and you want to go ahead and apply that to the face. Again, you do this only at night. In the morning time, you want to go ahead and use the Lumixyl system as prescribed with the Glycopil 10. No tretinoin in the morning. Same thing with retinols. You definitely want to use that at night. You definitely want to go ahead and cleanse with step number 1. Then you want to go ahead and mix step number 2, which is our brightening cream, with the retinol at a 50-50 ratio on the back of your hand. Then you want to go ahead and apply that thereafter. In the morning, go ahead and use the Lumixyl system as prescribed with the Glycopil 10. Definitely don't want to use the retinol in the morning as well. Some people like to add additional alpha hydroxy acids or glycolic acid. They like to use those as well with the Lumixyl system. We tell people that there is really no need to use additional glycolic acid, simply because we do have 10% glycolic acid in our Glycopil 10 product, and so that is sufficient to really give you all of the exfoliation that you need. Now we do have other accounts, other physicians that do like to use hydroquinone along with our Lumixyl topical brightening system as well, and you can definitely do that. And what we basically suggest is that you use the Lumixyl topical brightening system as prescribed in the morning, and then at night you want to go ahead and use the 4% hydroquinone at night instead of the topical brightening cream, so that at night basically what you would do is cleanse with step number 1. You would apply the 4% hydroquinone. You would finish off with the Glycopil 10, and that should be your regimen for the nighttime. We also have other accounts that like to incorporate the use of their vitamin C serums with the Lumixyl topical brightening system, and so the way to do that is simple. If the serum contains less than 5% vitamin C, you can definitely use it kind of like a toner after cleansing your skin, so that basically you would use step number 1 to cleanse. You would apply the vitamin C toner that has less than 5% vitamin C. Then you would go ahead and apply the Lumixyl cream, and then you would go ahead and use the Glycopil 10 and finish off with our Moisture Lock sunscreen. Now, if your vitamin C serum does contain more than 5% vitamin C, it's going to be a little too acidic to use alongside the Glycopil 10. So basically what you want to do is use your vitamin C serum that contains more than 5% vitamin C in the morning instead of using the Glycopil 10. So in this case, you would go ahead and cleanse. You would apply the vitamin C that contains more than 5% vitamin C. Then you would go ahead and use the Lumixyl cream, and then you would go ahead and finish off with the Moisture Lock sunscreen, and that is the morning regimen. The regimen for the nighttime is basically to use the Lumixyl system as prescribed. Now, as far as moisturizers, we do have those accounts that definitely call and ask about the use of moisturizers. You definitely want to prescribe your patients those moisturizers that are more water-based. We definitely would want to stay away from oil-based emollients. And the reason why is actually twofold. If you use an oil-based emollient, basically you can clog the pores and actually cause adult acne. The other thing is that if you're using oil-based emollients, they could slow down the overall efficacy of the Lumixyl system, because as you all know, emollients can definitely slow down the exfoliation process as well. So if at all possible, you definitely want to stay away from using moisturizers. If you actually have to use a moisturizer, I would definitely recommend using something that's more water-based. The last thing that we get asked about is how can we incorporate the use of growth factors with our Lumixyl system? Well, you can definitely use these growth factors. The way to do that is to go ahead and cleanse the skin with step number 1. You want to go ahead and then apply the topical brightening cream, which is our step number 2. Then you go ahead and apply the growth factor, either serum, cream, or lotion thereafter, and then you want to go ahead and apply the Glycopeel 10 and then round out with the Moisture Lock sunscreen thereafter. And that's in a nutshell how I would use these different topicals along with our Lumixyl system.
Thank you so much, Felipe. That is just the best slide. I absolutely love it. um, so this is just another thing that we can definitely speak at a different time. I don't want to run over on our hour too much, but this is called a Skin Fit Challenge, and it's a great marketing promotion that you can start any January that you want and continue it through the entire year, and just do that every year from now on. We know that everyone is trying to get back on track, and it's really a great way to get your patients to participate in a challenge that they can get engaged in. They can track their progress. And I'm sure it's happened to you before in the past that when their skin starts to improve, they sort of forget just how bad it was when they walked in the door. So it's nice to take these skin analysis forms and have them filled out. And if you have a Vizia, that's even easier. So they can really kind of see what is happening in their skin. And people pay trainers to work their body out, and you're doing this for their skin, and you're doing it for free. So you're like a skin fit trainer that helps them to check on their skin, and it's nice for them to make a habit of them returning to your clinic to participate in something that's good for them, that's not just them coming in to give you more money. They'll view that as you really are caring about them as a long-term customer and want to make sure that they've got long-term results, and that will just come back tenfold. So if you are interested in putting this Skin Fit Challenge into your practice, I have contact information at the end of this presentation. Give me a call. We'll look and see what you're doing in your practice right now, and then I will customize that program for you. So if anybody is interested, just give me a buzz and we will get that going for you. It's really fun. The staff loves it. Your patients love it. And they really do tell friends, and you get better client and patient retention, that's for sure. So the two great promotions that we are inviting you to participate in is really enabling you to take what we've just taught you and put it into your back bar, and being able to give your patients who are interested in this such a great value that you'll be sold out in no time. My med spa did something similar to this maybe about 8 months ago, and we posted it on Facebook, and the SilkPeel event was literally sold out in 3 hours on Facebook, and we had to book 2 additional days because people were demanding rain checks. So, and this is a way that in that regimen, I sort of did my own investment in the freebies that I gave away. But here, you don't have to affect your profit margin by all. Your cost of goods will be exactly the same because NV Medical, thank you, Curtis and Felipe, they are literally giving you all this product free to give to your patients. So if you don't take advantage of a freebie with the promotion that we kind of lay out for you, it's kind of silly because we're just going to help you sell more SilkPeels and get you more patients that will never leave you. So what we're doing is we're going to ask you to buy 3 cases of the Lumixyl infusion, which is going to be what you're going to be doing using in the Lumixyl Brightening Facial. But then we're going to give you 9 jars and 9 bottles of the pads and the Glycopeel 10 to give away to your patients when they sign up for their package. And then if you look at the 3 bottles of the cleanser, the jars, the Glyco 10, and the sunscreen, you don't even have to invest in any additional back bar cost. So it really is absolutely a plug and play for you. The second promotion is for patients that also want to start with the Lumixyl home care system. And we've made that absolutely impossible for them to refuse, because we're going to give them 1 full-size Revitalize, which is an amazing eye cream, and it's got a great following around the U.S. and the world, and a brightening jar of 60 brightening pads, plus a travel kit. And this travel kit is 1/3 of an ounce, which is many of the full-size products in the Lumixyl system. So it is quite a value, and it lasts about 7 days, 5 to 7 days if you're kind of close on not overusing the cleanser. So it's great for travel as well as trying the system. So those are fantastic deals, and they really are buy one, get one free with not only the SilkPeel promotion, but also with the take-home unit. So very excited about that. And again, thank you, NV Medical, for being so generous. It's just fantastic. And then if you look here on this slide, you'll see these are point of purchase displays that we have customized so that you can put your facility's logo. You can decide what price point you want for your silk peel, how many silk peels they need to purchase. So you can really customize these point of purchase displays, and we'll be sending you a link to be able to download these and customize. So I think this will be very beautiful and professional, and make sure that you look great and that the NV Medical brand looks great. And hopefully you guys will sell out with this promotion just like we did at our facility. So what we're recommending is if a client comes in, they want to join the promotion, we'd like them to purchase 4 brightening facials, and then we're going to give them the free brightening pads and the Glyco 10. So an average silk peel price in the US is around $150. If I'm going to bundle a series of 4 and do a real push for a silk peel event, I would do about a 20% off my regular pricing. So if you're typically selling a package of 4 for $600, you would then sell a package of 4 for $480, plus give them the free gifts. So bottom line is they're spending $480 for 4 magnificent silk peels, and they're getting free products and free services that value $324. So that is not your typical promotion. And again, when you really reach out to your patients, put a little video on there, a little testimonial from one of your staff or clients, you will be sold out in 3 hours if you post it on Facebook. So it's just fantastic. And the brightening system, again, is still almost a 1-for-1, because the patient can purchase the system. That's going to retail for $144, and then when you add up all the freebies that NV Medical is paying for, we don't have to pay for them, they're saving $184. So they're spending $144, saving $184. It's hard for women to walk away from deals, and this is definitely not your typical Clinique get a free tote bag. So they're going to be very excited. And I wanted to remind everybody that NV Medical has had so much success in the press, on television, in print, on different shows and talk shows. So please feel free to use these links. I would love to see them in-house on your TV. They're fun to post on Facebook. They're great embedded in an email or newsletter. And I love having these videos on your website. So when someone is perusing and looking at different physicians and they go, oh, they have this thing called the silk peel. Well, if they can click on an educational video, then they can click on something where a makeup artist is talking about it, or a physician on the doctors is talking about it. That just makes them, it's easier for them to call you and book an appointment. So, since we have all this great press, it'd be silly not to take advantage of it. We've had a lot of Lumixyl in the media. I've been hearing from a lot of my clients that now patients are coming in and asking if they have the brightening cream. So that's a great tipping point for the company. It's very exciting news. We've had SilkPeel in the press, as well, again, much media mentions. And all of these, the ET, the doctors, all of these we have on YouTube. So it's wonderful to put that in a blog, in an email release, or a newsletter, especially on Facebook. You really will get a lot of people, finally pulling the trigger and getting a silk peel when you kind of let them shop in different ways, not only information, but also with celebrity endorsements. We've got great collateral, so if none of these look familiar, make sure you talk to your sales rep or inside sales associate to order these great marketing collateral, as well as for the silk peel. For Lumixyl, pardon me. And this is what we have at my facility. So you can see the Lumixyl merchandising can be in a very small location, but it can look very clean and elegant, but then yet very clinical and result oriented. In my facility, we do a lot of sampling. And so at the bottom, you'll see on that display that those are all testers, so people can take home samples to try. Then we give them brochures, talk about the silk peel, and then they can see the full-size product on top. So that's an easy way to do that. And if people have different places in their facilities, and if you ever want to send me a quick picture and say, how do I, refurbish my display, I'd be happy to help you with that as well. We are creating a Lumixyl online media library, and we did our first quarterly webinar this past October on a back to school acne protocol with an acne facial, which was really successful. So if you want to take a look at that, there is that web link. I think we might be sending you a new one. I think that the Fuse company is sort of reloading that at the moment. So we will make sure that you get the correct link for that. And then these are probably three of my favorite videos is the Lumixyl video, my Lumixyl experience video, and then the introduction of Lumixyl with Felipe Jimenez, which is fantastic. I also love the SilkPeel video that we have. I put that a lot on Facebook and on newsletters and definitely on our website. And it's just so professional, and it really just helps the company and the procedure really stand out. And you'll just get more people booking for the procedures. So we'll be sending you out a recording of this webinar in the next 48 hours. And our promotions are going to expire on January 22nd. So make sure you take a look at your inventory, kind of decide when you want to start these promotions. Give me a call if you want me to implement the skin fitness with it. And then we can put together a program to make sure that it's implemented successfully and that you have a great, great event. You can either call your local rep, or you can call NV Medical at that 818-874-2700. And at the bottom of this, I have all my contact information, so you can call myself or email me, and I will be happy to help you in any marketing endeavors that you have. But we've done this promotion before. It's super successful. Like I said, we had to schedule 2 rain check days because we had such a huge response in about 3 hours. So if you do it, they will come. So I hope that you take the plunge, and we'd be more than happy to make sure that it's very, very successful. So thank you for joining us. I know we ran over a few minutes, but thank you, Felipe. It's wonderful. And I don't know if you have any questions that you want to answer at the end of this call.
Yes, well, thank you, Cindy. I appreciate your hosting this webinar. You did such a fantastic job. And I'd like to thank the audience as well for participating in today's call as well. I think we forgot to mention how you can go ahead and submit your questions early on. If you'd like to go ahead and submit any questions, you can definitely write them into the in-meeting chat. It's either a box that you see there on your screen, or there's a little icon, kind of looks like a little balloon. You can definitely click on that, and you can definitely submit any questions that you may have, and we'll go ahead and read them and answer your questions as you are sending them in real time. Are there any questions that anybody may have? Okay, so it doesn't look like there's any questions coming through on the in-meeting chat. Again, just like to reiterate that we would definitely love for you to take advantage of our webinar promotions for sure. Again, as Cindy said, to take advantage of these web promotions, please call your local NV Medical sales rep, or you can definitely call our friendly inside sales team at 1-818-874-2700. Additionally, if you have any questions about this particular webinar, about our products, or about how to implement the skin fit analysis, also how to implement the point of purchase displays and how to modify those, you can definitely reach out to our Cindy Duncan. She is our Director of Business Development. You can reach her at area code 406-531-7151, or alternatively, you can definitely reach her via email at cindy@nvmedical.com. Now we do have one question here. It looks like there's no name here, but we'll go ahead and answer it. It says, is it possible to get these notes printed from this webinar? Absolutely. If you go ahead and send me your email, I will definitely be more than happy to send you a copy of this particular presentation, and we'll make sure it gets out to you very shortly.
Absolutely, and make sure and let everyone know that we can always make this into a PDF and email it out to anyone, because I know a lot of people like to print some of these slides out for future reference.
Absolutely.
Thank you.
Okay, are there any other questions? Okay, well, if there are no other questions, oh, and by the way, thank you, Monica. It looks like you just sent me your email address there. I'll make sure and send you a copy of this presentation to your email for sure. We'll try to get that done just as quickly as possible. Okay, if there are no other questions, I'd like to thank everyone again for participating in today's call. Cindy, thanks again. Truly appreciate it. I absolutely enjoy doing these webinars with you. You're an absolutely fantastic host. And again, thank you to our audience. And again, please don't forget that our webinar specials do expire on January 22nd. And again, please make sure that you contact your local NB Medical representative, or you can call our friendly inside sales team at area code 818-874-2700 to take advantage of the online webinar promotions. Well, thanks again to everybody, and have a wonderful day.
And we'll be sending out the recording as soon as we get it.
Absolutely.
Thank you.
Thank you. Take care,
Bye.
everyone. Bye-bye.